do you take insurance? And are these surgeries covered by insurance typically, or what would make somebody come in and pay out of pocket versus going through insurance?
Sure. So, breast reduction surgery is one of those surgeries that can be covered by insurance. I don't take insurance, but I do a lot of breast reduction surgery for a few reasons. Sometimes patients aren't happy with the providers that they have in their network, so they would rather go elsewhere and pay out of pocket. Sometimes patients want a little bit more control over how much breast tissue is being removed. Insurance companies vary, but most of them mandate a minimum amount of tissue to be removed, which can be tough. So if you're
Is it like a
4'11",
strict number?
yeah, a strict number of grams. So 400 grams or 500 grams. And so you can imagine that if you're 6'1" and you have large breasts, it's probably easier to get 400 or 500 grams of tissue easily off. I'll probably take more. Certainly the young lady that we did that was 3,000 grams, that met that requirement. But then the other thing some insurance companies are asking for is that your BMI be below a certain level. And so these patients who desperately need breast reduction surgery are not able to get it covered by insurance because of an arbitrary BMI cutoff, whether it be 30 or 35. And so I think for those reasons that some patients would just prefer to get it done and worry about the rest of it. I've had patients that had very large breasts but didn't want to be too small, right? So you have a little bit more control when you're coming in to see me and I say, okay, well, I'm not hamstrung by the fact that I need to take 500 grams off. And if you really only want 300 grams off, we can do that. So it happens, it's so individual based on the patient. And just like anything else, something like an insurance policy is not going to be individualized towards patients.
I feel like we had a patient not too long ago who didn't qualify BMI wise, even though like her breasts were so large. And then they told her to what? Diet first or
Yeah, we've had a handful. I think there's a system in Southern California that is creating a strong cutoff of 30, which I understand, but some of these patients are clearly like, you know, some of that BMI is coming from their chest. So it's not like
yeah.
they have B breasts and are overweight. It's the opposite problem. And I really think that they can embrace a healthier lifestyle once you make their breasts more proportional to the rest of them.